Good morning, ladies and gentlemen. Welcome everyone to the School of Global Health Academic Forum today. We have a topic entitled Global Health Security Threats and Ways Forward. My name is Grisada Vutikan from the School of Global Health, Chulalongkorn University. I will be your host this morning. Global health security has been one of the most important public health interests, which require international collaboration in order to detect, prevent, and respond to infectious disease health threats. As we all know, the most devastating health threat over the past 3 years is COVID-19 pandemic. This is truly an unprecedented, difficult time that occurs hopefully only once in our lifetime. Today, we are very fortunate to have a panelist of experts in the area of global health who will share us their insight on what we have learned from the past and how we can improve to prepare ourselves for a potential health threat which may arise in the near future. First of all, I would like to invite Associate Professor Dr. Chanchai Sittipan, the Dean of Faculty of Medicine, Chulalongkorn University, to extend a welcome reception to our speakers and our audience today. Please welcome Dr. Chanchai.
Thank you very much. Dr. Tet Bunnak, Secretary General of Thai Red Cross Society, Professor Sudipong Wachanasin, Co-Chair of the School of Global Health, Faculty of Medicine, Chulalongkorn University, colleagues, students, ladies and gentlemen, this is my great honor to welcome you on to the Global Health Security Forum organized by our School of Global Health, which is an initiative that we launched at Faculty of Medicine, Chulalongkorn University since last year. It was actually a program that we planned well before the pandemic crisis, and it has shown to appropriately and timely serve the society's need. The global pandemic that started 2 years ago and still ongoing has certainly raised the public realization of how important the global health security is. The cross-border impact of COVID-19 outbreak emphasizes the need of fast-moving joint effort in research and development toward the prevention, detection, responses, and treatment. In this context, many ongoing research and development activities are progressively underway at Chulalongkorn University and Thai Red Cross Society. I am pleased to cite one exciting project here at the Faculty of Medicine, that is the development of Chula-CoV-19, which is an mRNA COVID vaccine, which has proved in the phase 1 and phase 2 to be effective, and hopefully it will be launched for the public use in the very near future. On the other hand, we also gain the experiences through operations to help communities and people of all races to respond and to recover from the health problems and emergencies. Indeed, the pandemic crisis has clearly indicated that health security is a big issue of great importance, and we need to join hands to overcome this problem. With this, as our mission to tackle challenging and emerging health issues, the School of Global Health is established to accelerate research, advancement, and capacity building in partnership with institutions from all regions of the globe and international networks and organizations. The School of Global Health acts as a platform to facilitate academic advancement and research development under the diverse range of postgraduate programs and other different activities that will be organized throughout the year. We are honored to kick off the 2022 forums today with the 3 well-known speakers and experts in the field of global health security. We are also delighted to have the Thai Red Cross Society as our partner to co-host this timely event. Final acknowledgement with appreciation extended to Chulalongkorn Medical School Foundation for the kind support to the School of Global Health. Let me again welcome the Secretary General of Thai Red Cross Society, Dr. Tet Bunnak, our distinguished 3 speakers, panelists, and all participants to the forum, and to enjoy these talks. There will be a lot more attractive activities to come under the School of Global Health this year. So please stay tuned and thank you very much. ขอบคุณครับ
Associate Professor Chanchai Satipan, Dean of Faculty of Medicine at Chulalongkorn University. Professor Sutipong Vacharasin, Co-Chair of the School of Global Health, colleagues and students, ladies and gentlemen. Good morning. It is a great pleasure for me to be with all of you in person and online in this forum organized by the School of Global Health. Given the importance of health, which now calls for local as well as global actions, the Thai Red Cross Society takes pleasure in co-hosting this meaningful event, and we will together do more in the years to come as it fits so well into our vision and mission to meet the Sustainable Development Goals, especially the SDG 3, that is to ensure healthy lives and promote well-being for all at all ages. Global health security is a concept that has evolved considerably over the past 30 years, and at its core focuses on averting bioterrorism and containing risks from infectious diseases. The concept has evolved to encompass more explicit security threats and complex issues, such as the antimicrobial resistance that are integral to infectious disease control. Overall, however, the field of global health security has not kept pace with the expansion of threats to global risks and security. But with no argument, global health security is a shared responsibility that cannot be achieved by a single actor or sector of government. Achieving global health security requires a sustained, coordinated, multi-sectoral approach that incorporates an understanding of the linkages between human, animal, and environmental health. I am delighted that the School of Global Health has invited speakers who are real players in the field of global health security. As the host of this forum, we thank Dennis Carroll, one of the pioneers who have involved in a number of initiatives and platforms to drive this issue. We appreciate the role of the Office of International Cooperation at the Department of Disease Control as the national authority for the global health security agenda. Thanks to the Office Director, Dr. Sawapat, for giving us the perspective of Thailand's engagement in the global health security agenda platform. We also welcome Dr. Chirut to give us his thoughts and findings from his study of the responsive health service system. Recently, the ranking of Thailand, 5th in 2021 Global Health Security Index and 1st in Asia, has given worldwide recognition to the nation for its collective effort to contain the COVID-19 pandemic. By the end of this forum, we will gain new insights on global health security issues and understand better how Thailand achieved this recognition. Ladies and gentlemen, the Thai Red Cross Society has the responsibility to assist in tackling the growing health issues. We are willing and ready to play a vital role in promoting better understanding of global health issues and also to match stakeholders for cooperation opportunities in Thailand and the region. I hope that this forum succeeds in shedding light into our roles and responsibility as a person, as an organization, and as a part of society to give our best contribution to the future of sustainable health security. Thank you very much.
Thank you, Dr. Ted and Dr. Chanchai, so much for a very inspiring opening speech and the highlight of the agenda today. Before getting to the presentation, I would like to give everyone some housekeeping information. For today's forum, we will start with all three speakers presenting first, and we will wrap up with Q&A session at the end. If you have any questions, please feel free to type in your questions using chat box or Q&A function. Next, without waiting any further, it is my pleasure to introduce our speakers. The first speaker, Professor Dennis Carroll, who is the chair of the Global Viral Project Leadership. He is also a distinguished professor at the Faculty of Medicine, Chulalongkorn University. Professor Carroll previously served as the director of the U.S. Agency for International Development. Professor Carroll's instrumental work and effort have been in the area of emerging infectious disease and influenza pandemic. Today, he will share us his insights on the very interesting topic entitled The Global Health Security Challenges. Please welcome Professor Carroll.
Thank you very much. First, I just want to make sure you can see me okay and you can hear me okay. Very, very good. Thank you very much. First off, it's an honor to be able to join this distinguished panel, to be able to talk about global health security. We are now in the beginning of year 3 of an unprecedented global pandemic. And even as we struggle with the ongoing pandemic, one of the core questions we should be asking ourselves is, how do we make sure we never have a COVID-19-like event ever again? What would it take to achieve true global health security? And what I'd like to do in my few moments is talk about one particular aspect that I believe is central towards ensuring the world is better prepared for future events so that we never again have a COVID-19-like event ever again. I'd like to share a screen with you momentarily, so just give me a moment, and to talk about not just global health security, but the central importance of a global viral surveillance network. I think all of us appreciate that in December of 2019, we began hearing the first signals of an emerging threat, the COVID-19 SARS-CoV-2 virus. But by the time we heard about this in December of 2019, we were already facing a fully constituted viral threat with efficient human-to-human transmission. And in fact, a month later, in January of 2020, the first exported case of COVID-19 was identified and reported in Bangkok itself. It was the first example of this virus being able to move out of China across the world. And Thailand really deserves an enormous amount of credit for being able to pick this up so early. But the question we should be asking ourselves, why was it that we did not know about COVID-19 before December? Obviously, this is a virus that had been circulating and moving through human populations for several months prior to the first identification in Wuhan. And what would be the difference in the future as we think about the next COVID, the next influenza, the next Ebola virus that might emerge? What can we do differently to make sure the world identifies future threats before they really have the potential to wreak the kind of havoc that the COVID-19 virus has played out across the world over the last 2 years? And I would like to talk about the central importance of a global viral surveillance network as a way of getting earlier insight before the virus establishes itself as a clear, immediate threat to global health security. So in the few minutes that I have, I would like to talk about, one, why do we need a different surveillance system than the ones we are currently working with? What are the existing surveillance systems? What are their strengths and weaknesses for dealing with emerging pandemic threats? What should, in fact, a surveillance system look like that would enable us to have early viral spillover detection? What are the realities of launching such a system? And then I will conclude by talking about challenges and opportunities and ultimately some final thoughts. So first off, let's ask ourselves, why a different surveillance system for preempting pandemics? We've had a long history in global health, certainly over the last 40 years, in investing across the world in improving the surveillance capabilities of countries from Asia to the Americas to Africa to Europe. But what we have seen with COVID-19, that the surveillance systems we have put in place were not the kind of surveillance systems that we needed to really give us the forward-leaning insight about an emerging threat such as COVID-19. And that's largely because, first and foremost, our surveillance systems don't recognize the first and most fundamental truth about emerging viral threats, is that they begin in wildlife. All past, present, and quite frankly, all future emerging threats already exist in wildlife. They are circulating among wildlife animals prior to their emergence and spread into human populations. But sadly, our surveillance systems are really not geared towards monitoring what is happening in wildlife or even livestock as a way of understanding what could pose to be a future human threat. And this is particularly important because the sheer magnitude of potential threats that we will have to grapple with as we go forward into the 21st century, the sheer number are enormous. We have estimated in work that I've been involved in over the last several decades that there are nearly 1 million different viruses circulating in wildlife animals today that could pose a threat to humans tomorrow. But we have no visibility because our surveillance systems are not tracking and monitoring what is happening in those wildlife populations. In fact, the current global disease tracking and monitoring systems are seriously stovepipe. That is, we live in a world with the human health sector operating totally independently of the animal health sector. And even within the animal health sector, the livestock community and the wildlife community, none of these sectors really talk and coordinate with each other. If we were to be successful, we need to be able to have a surveillance system that tracks a virus regardless of what species of animal, whether it's in Homo sapiens, us, or if it's in a bat, or if it's in a chicken. We need to have a comprehensive surveillance system that is capable of following the virus and allows us, in fact, to identify future threats before that threat fully emerges. COVID-19 underscores that early disease outbreak reporting, in fact, is too late. Identifying in December of 2019, the first human reported cases of COVID-19, in fact, was far too late for us to be able to mount an effective response to be able to isolate and eliminate this virus before it spread out of China. By the time we identified it in December, it was already a virus that had evolved and established its capability for efficient human-to-human, community-level transmission. That is why, in less than a month after it was first identified in China, Thailand, about this virus spreading beyond the borders of China. Ultimately, we need a surveillance system that is far more forward-leaning and allows us essentially to go to the virus in its natural habitat before it comes to us. Lastly, we need to expand our opportunities for surveillance systems and build on the networks and technologies that already exist. utilize that to our own advantage, but begin developing a surveillance system that is inherently multisectoral. We follow the viruses across bats, chickens, and people in a way that is consistent with a One Health vision, but most importantly, is consistent with what we know about the ecology of disease emergence. It's inherently a multisectoral phenomena that requires a multisectoral surveillance capability. So let's talk about expanding the viral surveillance network for all zoonotic diseases, any and all future threats. What would such a system need to be able to do? First off, we need to be able to identify viral spillover events from wildlife animals to livestock and humans before they manifest themselves in localized outbreaks, as we saw in Wuhan in 2019. So we need to have a capability that is forward-leaning and not waiting for those first events in humans, but to have a longitudinal surveillance capability that's tracking suspected future threats as they evolve across the ecosystem in wildlife, in livestock, and people. There is no such system, sadly, for such an active viral surveillance system. Nowhere in the world today do we have a system that is capable of tracking and monitoring a priority list of viruses that we would signal as future threats. We have systems that are capable of following known threats, but we fail when it comes to being able to track and identify future threats, the unknown viruses, those that are circulating in wildlife today that will pose a threat tomorrow. Remember, even as we learned about COVID-19 in December of 2019, that virus already pre-existed in wildlife 6 months, 12 months, 2 years previously. If we had an active surveillance capability to track and monitor the evolution of these viruses in their natural habitat before they spill over into people, we would have been in a far better position to be able to respond effectively and isolate and eliminate this virus before it ever established itself as a pandemic threat. And we've seen not just with COVID-19, but we've seen with MERS and with SARS, with avian influenza, with Ebola. Over the last 20 years, we've seen a repeated cycle of new emerging and pandemic threats that really signals to us we are living in a different age. The 21st century is unlike any century we've ever lived in before, really simply because of the sheer number of people that live on this planet. Take a moment and think about this. There are 8 billion people on this planet today. If we were having this lecture 100 years ago, there were less than 2 billion people. In the course of 10 decades, 100 years, we have increased the footprint of our species, Homo sapiens, on this planet on a scale unprecedented. And there are consequences as we build our cities, we expand our agriculture, we impact on the ecosystems around us as we move from 2 billion people to 8 billion people, or by the end of this century to nearly 12 billion people. We live in an age of epidemics and pandemics unlike we've ever lived in before. So what would such a surveillance capability look like? What do we have to do differently as we think about the future if we truly want to make sure that the world is safe from future COVID-19-like events? If we're really going to achieve global health security, what does this system need to look like? What I'd like to first off is to say our current surveillance system is largely, certainly from a public health perspective, is focused exclusively on looking at events within the human population. But we know, as I've already pointed out, that every future and past viral threat pre-exists in wildlife and in livestock, but we don't have a surveillance system that looks, if you will, to the left, further upstream, before it emerges and establishes itself in people. But what we need is a surveillance system that, first off, is really developing the science around viral discovery. When I talk about 1 million potential viral threats, being able to catalog and build a global atlas on future viral threats, understanding which viruses may have the genetic and epidemiologic characteristics that signal that they could pose a future threat to people, but they are currently circulating in wildlife. How do we build, if you will, a watch list of future threats before they emerge? Viral discovery is going to be a critical part. We need to go into wildlife, identify what is there, and not just identify the viruses, but begin to identify the viral ecology. What animal species are they circulating in? What's their geographic area? And most importantly, what's the interactive dynamics between human populations and our livestock and those species of animals that these viruses are circulating in? That will tell us about where hotspots on the world exist, where the spillover events are potential. And that allows us to think about a second level of surveillance, which is interface surveillance, being able to use the viral discovery, this exercise, to help us focus where geographically we need to look at interface surveillance. That is where the interactive dynamics between human populations and wildlife populations really speaks to elevated risk of exposure and spillover. Think of Wuhan for a moment. Clearly, one of the interface domains that should have been part of a regular surveillance system were the live animal markets that bring in wildlife animals that may in fact be carriers of future emergent threats, that we don't have that systematic monitoring of these really high risk interfaces, both in terms of monitoring the animals that are in these markets, but also the people that become exposed in these markets. Interface surveillance provides us with a really important tool, not only to identify threats and their risk of spilling over into people, but because the spillover is largely a consequence of our own behaviors, and it allows policy leaders and regulators to establish standards of performance in animal markets that really lower the risk of spillover. We don't just have to have a surveillance system to be able to identify a future pandemic threat once it's circulating in people. We have the potential to use interface surveillance to actually disrupt and prevent spillover from happening. But the combination of viral discovery that tells us where hotspots are, interface surveillance that tell us what the risks and the behaviors are, allows us to think strategically about what we can do about the management of those risks, what policy leaders and regulators can do about making animal markets safer, making farms safer, making the interactive dynamics between human populations and animal populations safer. But ultimately, we also have the ability to link the viral surveillance discovery with interface surveillance with the ongoing surveillance for human event surveillance, looking for the early cases of infections, even before they become symptomatic. The opportunity to identify high-risk populations in these interface domains for telltale signatures of exposures of infections. It allows us to discover not the COVID-19 virus in December of 2019. We would have had the opportunity, in fact, to have discovered that virus in its really primitive state as it was establishing the efficiency of its transmission back in November, October, when it was far more containable and controllable. So ultimately, these strategies of moving surveillance further upstream past a focused, exclusive focus on human surveillance into viral discovery and interface surveillance, and linking that to human surveillance allows us to transform our whole notion of what it means to prevent, detect, and respond. But having a system like this has many challenges. There are many technical challenges. The sampling frames. Which wildlife animals do we collect samples from? How often do we collect? What are the types of samples? Do we take blood samples, saliva samples, urine samples. Understanding those sampling strategies are going to be critical. We need to also think about the human resource capacities to go out and actually do the kind of field collections that gives us access to the samples that ultimately talks about the importance of laboratory structure, our ability to do the analytics on the samples that are collected. Those are challenging because they're inherently multi-sectoral, linking animal samples with laboratory diagnostics and analytics and human risk is a transformative approach towards surveillance. And lastly, once we have the analytics and we have the beginnings of a database, how do we manage it? And how do we manage it in a way that allows us to have open, transparent, non-exploitive use of the data that benefits all, not the few that may have sort of economic or political weight? How do we create an open and equitable and transparent surveillance and data management system that works to everyone's advantage? Towards that end, there are governance issues. How do we make sure the policies and regulations, the legislative framework that help guide actions that are driven by the information that we gather from this surveillance? How do we make sure that when we identify hotspots and risks, that we can link that to policies and regulations that allow local authorities to begin managing, again, the animal markets to lower the risk, making them more hygienic, making them less environmentally risky? Linking the data to local action as well as global action is an imperative. And then we have coordination. This is an enormously challenged issue. It's not just about having buy-ins and ownership from countries, regional and global organizations. It's also about being able to coordinate across the multiple sectors that are involved and the different professional domains that such a surveillance system challenges us with. And it means we also need to build partnership with development partners and the private sector. So this is a comprehensive sort of One Health multi-sectoral approach that really has inherent challenges, but they are ultimately solvable if we have a shared vision, an agreement on core principles of what such a surveillance system would look like. And we have the kind of open and transparent dialogue that builds the kind of alliances and agreements and partnerships that allows for open, transparent actions in the way forward. That said, there are many advantages to a system like this. First and foremost, new information on novel viruses and their risks, being able to sort out among those million potential future threats, which are the ones we have to pay attention to, which are the ones that have the genetic and epidemiologic signatures that we say we need to track and follow. And how do we, build into that the ecologic, social, economic, political, and behavioral risks, understanding those issues, because again, it's not just about being able to respond to an emergent threat. If we really understand the ecology of disease emergence, it allows us to prevent. Let me say something very clearly. If we are forward-leaning enough and our ability to harness this information, there's no reason why we can't prevent any and all future pandemic threats. It's also about building better, the opportunity to invest in the capacities and systems, the infrastructure, the knowledge, and the skill set of the institutions that would be required. This begins at the local level and all the way up to the national level, regional, and global. But ultimately, it's about building harmonized, multi-sectoral systems and capacities that will be transformative in the way forward. And it is also about making sure that we have not just investments in identifying future threats, but it's identifying the opportunity to build in an environment that makes the ecology around us healthier, the environment healthier, animal populations healthier and human populations healthier. This is an inclusive approach towards creating a healthy planet. Ultimately, it's about One Health. How do we tear down the silos that have isolated medical professionals, public health professionals, veterinary and ecologic professionals? Ultimately, future viral threats move across all of those sectoral domains. We need to have the resilience and the elasticity and the flexibility to be able to move across sectoral domains with the same ease and adaptability that viruses do. So conclusions. First off, COVID-19 should be really a teaching moment for all of us. Even as we struggle with the ongoing pandemic, we know that COVID-19 is not a black swan event. That is, these pandemic threats don't just happen once every 100 years. We know because of the dramatic surge in human populations, what maybe 100 years ago was once in a 100-year event, because of the sheer explosion in human population and our disruptive effect on the ecosystems around us. Those 1 in a 100-year events are now becoming 1 every 5 years, 1 every 3 years, 1 every 2 years. And if we are going to have a future that is truly realizing global health security, then ultimately having a surveillance system that is inclusive of the ecosystems, the animal populations, and human populations is a prerequisite to preventing future pandemics. But let me emphasize that universities, and in particular schools of global health, have a central role in guiding national and international partners in establishing such a global early warning surveillance through, first off, generating the evidence base for a comprehensive surveillance system, being able to shine a light on the evidence that's needed for what the sampling sizes are, for instance. Universities are going to be central for being able to build that kind of evidence base. They're going to be absolutely critical for validating the value of policies and regulations that will be critical towards being able to successfully prevent and control future outbreaks. We need to have ongoing monitoring and evaluations and having clear metrics for success. Universities will be critical towards establishing that metric for success. And ultimately, most importantly, universities will be the engines for building the next generation of leaders, for training that next generation of leaders to be able to look at the challenges posed by future emerging threats with a multi-sectoral vision that allows us to coordinate and interact and dialogue and ultimately act across multiple sectors simultaneously. You, the future leaders of tomorrow, have the opportunity to transform the risks that we face today. Again, COVID-19 should never happen again, but critical towards making it never happen again is having the kind of insight about what future threats might look like and using that information to preempt their emergence. And if they do emerge, to isolate them and eliminate them so that we never have a COVID-19 event again. So thank you very much for the opportunity to participate in today's discussion. I'm honored and I look forward to the discussion. And most importantly, I look forward to the other presenters and learning from them as well. Thank you very much.
For your comprehensive and excellent talk. There are a couple of questions from the audience, but to ensure that we'll have interactive discussion, we'll leave all the questions at the end when we have the Q&A session. We'll move on to the next speaker. I am very delighted to introduce Dr. Sawapat Hinjai. Dr. Sawapat is the current director of the Office of the International Cooperation, Department of Disease Control, Ministry of Public Health. Dr. Sawapat will share her experience on the very interesting topics entitled Global Health Security Agenda, Reflection from Thailand. Please welcome Dr. Sawapat.
Thank you very much for giving me. This is a great opportunity that in the how we can share with you about how the Thailand have implemented in the JSSA in our country. And so that is, I would like to provide you a background and overview of the JSSA, and then I will bring you to see what the main contributions or the activity that in the Thailand have implemented during when we were chairmanship of the JSSA last year, and we still continue as in the JSSA member for this year and the other year as well. For this picture, that's remind us to see that in the during the in the 2020 that in the Netherlands chairmanship, this is like a handover ceremony that's in the Netherlands. They hand over of the chairmanship to Thailand, and this is occurred during the JSSA ministerial meeting, the 6th JSSA ministerial meeting. And this is a whole picture of in the JSSA, and the JSSA have initiated in the 2014, and that time within their try to build capacity of the members and the other countries to meet the criteria, to meet the indicator of in the international health regulation. You can see the keywords that in the prevent, detect, and respond. This kind of the originate word that in the how we contribute and convey a lot of activities under these keywords. And so during the Kampala Declaration, and that time we still go along well within the JSSA 2024 framework. This is kind of the journey that in the how JSSA when they start in 2014, and that time Thailand has joined the JSSA member, and we were the lead of in the laboratory system and workforce development. We contributing country of in the MR action package. During the second phase from 2019 to 2024, Thailand is joining as in the permanent member of the JSSA and be serving as the chair in 2021 last year. On in the 2020 is on in the November, and that time Thailand is the host of the 6th JSSA ministerial meeting in November. And then one of important outcome of the 6th JSSA ministerial meeting, this is the chair declaration. This declaration telling us that in the what the Thailand would like to convey or in the contribute activities and have the direction on the JSSA. This declaration was endorsed by the Thai cabinet. And so from the declaration, we show in the important keywords that in the we involved within the different ministry and also within the academic institution to join in this in the JSSA forum. And for the task of in the how we can continue our work on in the JSSA at the domestic level and the international level, the Thai JSSA Coordinating Office has been established in 2019 within the technical support and the financial support from the Department of Disease Control and other governmental sectors, and also from in the Thailand MOPH CDC, USCDC collaboration, USAID, and the FAO regional office in Bangkok. This is the achievement, the lead in the Thailand chairmanship in 2021. Let's start within our journey. This is all the picture from the 6th JSSA ministerial meeting. And this is the first time for JSSA ministerial meeting that was conducted by in the it's kind of like a virtual, and also in the some person join in the online meeting, so that we call in the hybrid meeting. This is occur because this is like the COVID-19 pandemic that in the emerge, that in the it's difficult for in the JSSA members and in the high level can come to attend the ministerial meeting. And even that you would like to see and to explore what in the happened during in the sixth JSSA ministerial meeting, you can look at in the JSSA website, and we upload on in the video and also in the slide presentation of in the sixth JSSA ministerial meeting on in the JSSA website. And for in the we came for in the 1 year, and then we complete our tasks, our missions, as in the last November last year. And you can see that in the from the right hand side, this is we are Thailand. We already in the handover the chairmanship of the JSSA to Italy. And this this picture title capture was in the main contribution dealing in the Thailand chairmanship on in the JSSA. The keywords is a bridging cooperative action, because in that we know that in the every organization has their own responsibility in the term of in the prevent, detect, and respond. But the question that how we can coordinate, how we can integrate the activity of in the each organization together in the improve prevention, detection, and response. So the important thing that in the Thailand we host in the organize the steering group meeting and also in the support group meeting. The steering group meeting and support the steering group meeting is already in the is kind of like the frame is a frame in the JSSA 2024 framework. So steering group meeting that's in the Thailand horses, but or in the JSSA steering group meeting is kind of like in the online meeting. But in the the last steering group meeting that in that time, Thailand started the campaign about in the test and go. That means there some countries, some in the JSSA member, some in the speaker can come to Thailand, because in the we organize the meeting in Phuket. And for in we organize the support group call every month. That's we call for in the permanent member, rotating member, or permanent advisor to talk together and to like have a plan, set a plan for it, what we will do for in the next step. And we support a momentum of in the working together within the all action package and task force. Thailand also facilitated the meeting to endorse the new task force. That's in the new task force that emerged during the Thailand chairmanship. We have in the first one, this is research and development. And also for in the new action package that we call in the legal preparedness that also occurred during the Thailand chairmanship as well. For in the sustainable financing package or preparedness action package, these action packages have very active to organize, have like a webinar and provide and the forum that the people can share, because all of us know that in the site our sustainable financial preparedness is very important. It's just not for in the COVID-19 pandemic to respond that, but for in the future pandemic as well. And then we support the expansion of the JSSA member. And now we have 74 JSSA members, both in the countries and also within the international organization. And we support a diversity of the JSSA steering group member in different regions of the world. And we work closely within the JSSA secretariats that in the friend from in the Pakistan and Indonesia that in the we have and a lot of meeting within the JSSA secretariat. And now you can see from this picture that in the distribution, the composition of in the steering group or steering group member in the from now. This is from it, if in the like a gray color, you can see that in the gray color, the country is a permanent steering group member, and we have in the Thailand is one of the permanent steering group member, and also we have in the rotating or steering group member, and we have in the permanent advisor. You can see that in the asterisk in the UK, Nigeria, and Ethiopia. This is a three country that's a joy within the rotating steering group member. From this picture, you can see that in the how the JSSA governance or in the infrastructure have like a diversity in the term of in the regional mechanisms. And now let's focus on in the Thailand's efforts as in the JSSA member. Okay, we categorize into in the four things. For the first one, that in the Dr. Carroll just in the said about in the how like highlight on in the One Health concept, and also in the term of in the whole of society approach, and investment of in the health workforce is very important. And from in Dr. Carroll slide presentation that in the he addressed a lot of things that in the how we need to increase and improve the capacity and ability of in the workforce in the foreign the workforce development. And also in the foreign the other two things is just like a sharing key lesson learned that in the when Thailand have confronted with the COVID-19 response to the other countries. And we sharing the interaction review result and utilizing the results. This is important because after when we launch in the response for like a certain period, we need to know what we went well and what we went less well. So the WHO and the external result help us to frame the picture, tell us what is a good things, what in the challenge that Thailand should feel during the COVID-19 response. And this is a picture that show you that in the for the efforts in the term of in the workforce development. We gave in the example for the COVID-19 response. We can see that in the square of the light blue square, we are our government, our in the policy maker. We know that if we can improve the capacity of in the personnel, from the light blue square, that means that in the we can increase ability for the response in the emergency operations center. That means that we can increase ability in the term for in the case management and for in the laboratory. And this is our strategy of the Thailand, how we would like to increase the workforce development. That means that we need both things, sufficient workforce and strong network. For in the first multidisciplinary that in the we would like to increase, this is epidemiology. It's as an epidemiologist. Because in the epidemiology, it's kind of like the frontline worker that to know what in the contain the disease and also help to in the control the outbreak and also identify SARS, and they can work within the other sectors. And epidemiology, it doesn't mean that it's only for in the health sector, but we provide like beyond the health sector. That means we include the livestock sector and also the laboratory partner. That is they work together. It's just like a team. So we campaign for in the 4 key strategy for in the workforce development. For the first one, that is like active recruitment or recruitment of people. Second one, training program with quality standard. And the third one, this is retention of mentors. And the fourth one, enhancing the network and support. The network, that's good that in the JSSA, they have in their one action, there is also one action package. This they call in the workforce development. And Thailand, this is the lead for in the this action package. That's meaning that we try to maintain the network of in the workforce, include the people from the different sectors, epidemiologists, laboratory technicians, veterinarian, and so the wildlife sectors. And this is the picture that show you in the number of in the field epidemiologists in Thailand. And I didn't show you about in the foreign the veterinarian program. This is just for in the health or sector that you can see that in the we have different level of in the these are epidemiologists in the advanced, intermediate, and like in the basic in the basic program. This is the professional program that's we call in the field epidemiology training program. In the many years ago, we just have maybe just in the central level, and now we spread, we expand our program to other regions, and this is almost cover for the whole country. And so we have in the intermediate level that in the people like from in the from in the public health officials, and also in there some veterinarian, they also join together in the same cohort. And for in the FETH, that is kind of like the 1 year that in the for in the public health official will join this program and train and in the real field. And also, and now we start to include like the people from in the veterinarian or sector and in the Department of Disease Control to join this program. For the next one, let me focus on in the One Health concept and in the whole of society approach. This is one of in the successful story that in the how we work within the other sector, health sector, animal sector, and the environmental sectors. We adopt in the guideline that we call in the joint risk assessment operational tools. This is a guideline was developed by the WHO, FAO, and OIE. And then they start to ask the country that would like to implement this tool in the country. In Thailand, it is one of the country that we can see how important even the other sector do in the term of in the joint risk assessment. From the picture, we use in the example of in the avian influenza to be like the practice in the joint risk assessment. And we invite the people from in the provincial level, from in the central level to join. That's meaning that you can see a lot of people come and then they think about in the like in various perspective from in their sectors. This is good that in the we practice how we do together in the term of in the risk assessment. And for in the other two topics, it's kind of like the sharing key lesson learned and also in the sharing international interaction list review result. I would like to compile both together. Okay, and let's see from in the like in the point of entry in Thailand. You can see that the Thailand have a long border. It's a long distance within our neighboring country, and also we have in a lot of in the point of entry. You can see that how is the risk of in the any health test that can occur. That means we try to strengthen the point of entry and the strengthening of in the point of entry. This is one of the keywords that we learn from in the interaction review. And also we share this how we need to prepare and strengthen the point of entry to the other country. This is kind of like the lesson learned from Thailand during the COVID-19 response. And we know that in the cross-border area cooperation, this is a keyword. Because in we cannot work alone. We cannot just not build like a strong network in our country, but ignore for in the other country. That means we start to like collaborate and coordinate within the neighboring country, and also we move to forward to in at the regional level. So we use a lot of tools, just like MOU, MOD, or in the information exchange platform. And also this kind of like the rapid response team, joint team between the countries. And it's just not only the national level, but we expand the idea of in the JSSA to in the provincial level. Because we start with the pilot of in the JSSA at the subnational level along the border area. So the province at the border area, it will be like our initiate collaborative that they start to adopt in the JSSA idea, the concept to that provinces. And for the laboratory system action package, this is Thailand is a solid for the laboratory system, and the Department of Medical Science, they have like they organize regular meeting within the partner within the network. And you can see from in the this slide that in the link at the first of in the COVID-19 response, at that time just only in the national level can test, can do like in the reference laboratory for the COVID-19, but within the work together within the academic institution and the different sector, we can expand to cover all the provinces in Thailand that can test and the laboratory test for the COVID-19. And also we develop in the term of in the biosafety mobile unit to go to in the each community for testing. And for in the subnational level, we move down to in the at in the community level that we call in the village health volunteer. During the COVID-19 response, we provide education, and we provide in the strong network within the village health volunteer. And now we have in the over 1 million of the village health volunteer that help the health sector to contain the COVID-19. And but village health volunteer, it just not only focus on the health problem, but they also engage within the livestock development. So maybe in the some person, they just one person, they can be health volunteer and also livestock volunteer. And this is just not only for in the term of in the workforce, like the person, but in the term of in the law enforcement and regulation. We use in the, we apply for in the Communicable Disease Act 2015 for this law having the very important because in the key impact of in the this law, that's in the we highlight the importance of in the multi-sectoral and multidisciplinary. So that means that in the all the people, all the sector have to engage and have to understand what in the how important of in the when we apply the law to contain the disease. So that means in this law we have the guidelines on the surveillance and the prevention, and we also ask in the like a veterinarian or in the other sector to understand in the this law. And this term of in the strong network and in the collaboration, as in the Dr. Carroll in the state that in the his during in the his talk, and also from in the JSSA, the direction of in the main keywords of in the JSSA and the Thailand efforts, the multi-sectorality and the network is very important, and that's why you can see that from in the national level. We have a subcommittee of in the JSSA under International Health Regulation. Under this subcommittee, they are composed of in the people from in the Ministry of Foreign Affairs, Ministry of Agricultural and Cooperatives, Ministry of in the Defense, and other NGO that we try to like maintain this network, and then we share, we train within we still like contribute or in the workforce development through in the epidemiology training program. And you can see that we have in the collaborative platform, just like ASEAN or in the MBDS, Mekong Basin Disease Surveillance. And we work with in the development partners, strategic partners, just like a USAID, FAO, WHO, OIE. And also this is kind of like that's mean in the JSSA. This is it can be the good picture that how we can go strong in the term of in the prevent, detect, and respond of in the infectious disease. And this is a model slide that in the from in the last year that in the global health security index that in the show review the result. And Thailand is in the fifth country that we have like got in the score rank in the term of in the global health security, and we received the first score, the first rank in the term of in the early detection. But you can see from in the left hand side, it's just not only that in the we just look at in the good things, but the some point that in the we see that we still like have to more developing within the other sector. So this is often the Thailand efforts on in the JSSA. Thank you very much.
Thank you, Dr. Sawapak, so much for your excellent presentation. Our last speaker for this morning, we have Associate Professor Dr. Jirut Siratanaban, who is the current Associate Dean for Planning and Development, Faculty of Medicine, Chulalongkorn University. Dr. Jirut is the expert in the area of health service system and health policies. He has published several peer-reviewed articles on Thailand health system. He also has participated in the implementation of the national health policies in Thailand. He will give us a talk on a very interesting topic, the preparedness and response of health service system. Please welcome Dr. Jirut.
Good morning, ladies and gentlemen. I would like to thank the School of Global Health, Faculty of Medicine, Chulalongkorn University, for inviting me to join this session to share with you some of the experiences that I and my team learned from the COVID-19 crisis in Thailand. I do hope that some of the lessons that we'll share today will shed some light on the health security issues today and at the same time the way forward. My talk will be based on the study that I and my team have run for a couple of years since the beginning of COVID-19 situation in Thailand. It is funded by the Health System Research Institute in the year 2020 to 2021. The main content will be focused on the first wave of the COVID-19 crisis in this country. Although a very short period of time, but we can learn many things from it. I'll talk about key challenges of the COVID-19 situation in this country and some of what we can learn from it and what we have done and what to do, at least recommended to do for the future. I would say the COVID-19 is a real VUCA disease. VUCA is a term short for volatile, uncertain, complex, and ambiguous. There are some key challenges during the COVID-19 situation in Thailand that we can learn from, although we have proved to perform quite well in terms of health security and how we respond to the situation. You may have learned that Thailand is very strong in terms of health security, including a very strong public health infrastructure, including health facilities and health personnel. And also we have universal health coverage that allows people to access healthcare with minimal financial barriers. But the COVID-19 situation proved that there are certain challenges we have to solve, including medical supplies, disruptive impacts on our hospital service operations, the need to organize during the crisis moment, and we have to continue to provide care for the non-COVID patients. And there are issues related to public communication. If you can recall, the first COVID case was detected by our team at the Faculty of Medicine, Chulalongkorn University and the King Chulalongkorn Memorial Hospital in early 2020. We announced the first case, I think, in this country on the January 13th, 2020. After that, there was some public cry out, including in the healthcare field, related to PPE, personal protective equipment, especially surgical mask and N95 mask. This cry out for inadequate supplies hit the healthcare system very hard, not only in hospitals, but also few health personnel and the public at large. We can learn about this crisis by looking at what people talked about in the internet. This graph that I showed on the slide came from Google Trend, which is very simple internet tools that we can use it to learn about how people react or respond to the situation, especially during the crisis time. And you can look at the wave here in blue, which is about surgical mask or หน้ากากอนามัย in Thai term, and the N95 mask in red. And the crisis, at least what we learned from the internet, lasts for about 2 to 3 months until it subsides in late April and May. People, if you can recall, even you have money, you cannot find and buy quality mask. Hospitals also, we did not have a lot of inventory in terms of PPEs during normal situation. Fortunately, the issue subsides for the first few months, and Thailand was very effective in controlling the first wave of COVID, limiting the number of infected cases for a few, I think, 1,000 cases, not much. Hospitals is a main frontline unit fighting COVID-19 situation. We have done a survey in June 2020 after the first wave crisis to explore how the situation impact hospital operations and what did they need to prepare themselves for the crisis. You can look at the table here, especially the number that has been screened in yellow. Medical equipment, including medical supplies like PPE and ventilation, also one of the top areas that hospitals say they were hit hard in terms of inadequate number of supplies. But the most impact or affected areas was environmental management. Most hospitals face an urgent need for building isolation rooms, negative pressure intensive care rooms to accommodate the COVID cases. And these happen not only in hospitals that in affected or epidemic areas, but also in other areas that have no COVID cases during the first wave. The second, and another area that have a lot of impacts on hospital operations was related to human resources management. There are needs for manpower relocation and also needs for capability buildings, trainings related to COVID-19, and also There were needs in areas that related to occupational health risks, also acquired infection, overwork, fear, and anxiety among health personnel. Many hospitals have to downsize their routine operation, and to do that, in order to relocate resources to build up services for COVID-19 cases. New services have to be set up. In our survey of 728 hospitals, most of them have to build new acute respiratory infection clinics or ARI clinics. The service was not there before the crisis. Many hospitals have to build isolated cohort wards and rooms, also field hospital or shelter wards, as well as hospitals. The innovation that we have in Thailand to use hospital and hotels to work together to serve COVID-19 patients and patients under investigation, the one that we suspected to have COVID-19. Believe it or not, after the first wave that we learned, 12 months later, we still face the problem of inadequate beds, at least at the beginning of the crisis of the epidemic. During the fourth wave epidemics of COVID-19 in Bangkok, you can see the number here that I circle in red. The people that wait for beds after they know that they have been infected with COVID-19. At least at the beginning in the Bangkok area, this is a challenge for people living in the capital city. Although we have a lot of hospitals here in the Bangkok and vicinities area, it is not enough to accommodate the rapid surge of the COVID case. A lot of initiatives have to be periodically reviewed and improved during the crisis. We have to optimize how we utilize hospital beds so that we can serve the people really in need. At the beginning of the COVID crisis, almost all COVID cases had to be admitted to the hospitals. After we learned and reviewed about the cause of diseases, we know that the green patient or the patient with no symptoms or very minor can stay home. And then we have to review our protocol and guidelines for admitting the patient and move hospital beds to be used towards more severe cases, the red one, the red group, and the yellow group. We also learned that during the crisis, no one can work alone. In Bangkok and vicinity area, we try to form hospital networks or zoning for taking care of people for a long time unsuccessfully. But during the crisis, these hospital zones and networks become very useful to set up as a safety net for people with COVID-19. In Bangkok, we organized into 6 zones and with collaboration from hospitals under different ministries, universities, as Bangkok Metropolitan Administration, military, as well as private hospitals. We also learned that we need a very agile healthcare system when dealing with a crisis like COVID-19. We have to combine multiple channels, platforms, and healthcare settings in order for people to access healthcare rapidly and effectively, and have to channel patients to flow through different settings according to their severity in order to optimize how we use healthcare resources. Many innovations have come into play, including shelter and field hospitals, hospital that I told you about, and also home and community isolation. They are combined along the patient pathway to allow patients with different disease causes to switch among these settings in order to make sure that they get proper health care. Agile and flexible adaptive systems help make sure that people access safe and quality care given limited resources. That's a very key learning point here. Another challenge that we have to learn from and be prepared is a challenge that is related to public communications to allow patients to actually access the system. Who to make first contact, where to go first, and how to make sure that people get help. In the slide, I demonstrate multiple channels that people in Bangkok and vicinity area can use to access COVID care. Thanks to the volunteerism, and a lot of people wanted to help to make sure that COVID-19 patients get their help. It works very well for a short period of time. After that, it created a lot of confusion and complexity in terms of the organization of care. But thanks to the collaborative work in Bangkok and vicinity area that people try to set up the system that make it easier for people to access the care. Right now, the number 1330 organized by the National Health Security Office become a center of all of this. However, to provide health security, we have to think about a bigger picture, but not only COVID-19 patients that needs help. There are other people with other kind of sickness that need health care. We monitor the impact of COVID-19 on overall health services, look at the number of outpatient visits and inpatient admission during the first wave of COVID-19. If you look at the graph here, the black line represent the number of outpatient care for non-COVID-19 patients in the year 2020. The rest, the gray line and the dotted yellow line, the number of outpatient visits in 2018 and 2019. There are four graphs here. The first one on the left upper left-hand side was the number of cases in the provinces with no COVID cases. And then on the upper right-hand side, for the provinces with 1 to 10, the lower left-hand side, 11 to 100 cases, and the lower right-hand side, provinces with more than 100 COVID-19 cases during the first wave of the crisis. You can see that in all areas, number of outpatient visits decreased. So the impact of COVID-19 on general healthcare services were not limited to provinces with COVID-19 cases. And the impact remained after the acute phase of the crisis during April to March, April, and May. The crisis is kind of over, but the number of outpatient visits did not climb up to the level before the crisis. In terms of inpatients, the picture are quite the same. The number reduced a lot during the April and climb up slowly, but not to the levels before the crisis. And this include areas with and without COVID-19 cases. How about patient outcome? How about patient outcomes? We explore many diseases in terms of outcomes, but this is the example on acute myocardial infarction cases that were admitted to hospitals. Comparing provinces with without COVID-19 cases and provinces with more than 100 COVID-19 cases. You can see the drop of the admission for acute myocardial infarction cases in both areas. Fortunately, maybe because of the brief crisis during the first wave of COVID-19, the number of and the rate of acute myocardial infarction mortality remain quite the same. The rate were not increased as we worried. We also look at the admission of ambulatory care sensitive conditions. There are cases like diabetes mellitus, hypertension, asthma, or acute cases like urinary tract infection and diarrhea. Ambulatory care sensitive conditions are traces of the quality of access and qualities of ambulatory care. We surprisingly saw a drop in ACSC admissions during the COVID-19 crisis. You can see the number drop here in provinces with no COVID-19 cases, also in the provinces with more than 100 COVID-19 cases. So it's very difficult to assess the quality and access for ambulatory care. But we learned that the impacts of COVID-19 affect practice pattern, at least in terms of hospital admission when dealing with patients like DM, diabetes mellitus, hypertension, when they need hospital care. There were definitely reduction in admission for these cases. We proposed in our report that we need an integrated management framework to deal with health system preparedness and responses, especially when we're facing panic situation like COVID-19. This is our research framework that we propose for us to come up with research studies and findings in order to enable us to prepare for the next crisis, which include issues within the health system and also the linkage to the country, especially how the public and the other sector at large that responds to the crisis. And the third here, the third section here is international linkage. And we cannot ignore the mobility of people across country, how we face the risk, the global risk, not just the country risk, how to open to international response and international recommendations. In sum, I would like to recommend that we have to come up with very effective health system resilient framework in order to anticipate, prepare, respond to immediate threat, and recover quickly to ensure health for all. We need to work as a network instead of individual institution or individual sector in dealing with the crisis like this, including both health services and also supply. We critically need integrated information system for resources management during the crisis and in preparation for the crisis. We need effective communication and information sharing with our stakeholders and the public. And also, we need to strengthen our supportive ecosystem, including regulatory requirements, financing mechanisms, and budget system. Big picture, but act now. Do what we can do and do it now. Fortunately, that we have a very close collaboration with a healthcare accreditation institute in Thailand. So this is an example that we do to ensure that the health system in Thailand are prepared for the next crisis and make sure that the lesson we learn become the next normal of our health system by integrate the finding that we have from the study into the health hospital and health service standards that we use for accreditation program. This is an example that research findings can help strengthening health security in terms of health system preparedness and how should we respond to the crisis, including organizational resilience, new modalities of healthcare, and of course, patient, personnel, and public safety issues. Thank you very much.
Thank you, Dr. Jirut, for your outstanding presentation. Now we have our three speakers sharing their experience. In the next session, we'll move to the panel discussion session where you can ask questions and interact with our speakers. So we have some questions which the attendants type in the Q&A session. So the first one, I think it is for Dr. Carroll. The question is, what Dr. Carroll envisaged is a very intrusive surveillance system that will absolutely depend on our governments across the world having the resources and willingness to participate. Is the WHO going to be the policeman? Is there going to be surveillance of virus research laboratories? And there is another associated question from another attendant. Who will be the sponsor for such active surveillance? Please, Dr. Carroll.
Thank you. And first off, let me congratulate my fellow panelists on really excellent presentations. I've learned a lot for me this evening, for you this morning. So thank you very much. Yeah, the question is a good one. You know, the question of governance and ownership on any such surveillance system, because it really needs to have a couple of key features, even as it needs to be global in scope. It needs to be locally owned. Ultimately, you're talking about surveillance at the community level, and you're talking about information that should first and foremost inform local leaders on risks and actions that they can take to mitigate those risks. But we also need to channel that information up into a global portal that allows us to see trends and dynamics as they evolve across countries, across regions, and across the globe at large. So a governance of such a venture is really going to rely on a network of national level, national led surveillance activities. So it's ultimately about building a network of alliances among countries that agree on certain standardized protocols to make sure that the surveillance data that you're generating are comparable, that data coming from Thailand can be compared to data coming from Uganda, for instance, and that everyone is committed to sharing their data into a common data portal. But there are enormous challenges with creating a global data set that is consistent with country ownership and the issues of openness and transparency. So these are very complicated issues and very complicated questions that need to be addressed and solved. WHO and the other UN partners, such as the Food and Agricultural Organization, are going to be central towards ensuring that the standards and the protocols are consistent with the highest standards of excellence and the highest standards of safety. But I also believe that the UN system isn't the place that provides the ultimate leadership. It needs to be a coalition of national governments, ultimately led by national authorities, committed to a shared vision and shared action. So it needs to work with the UN. It needs to have the leadership of the UN, but ultimately it needs to have the ownership of national governments. So it's a very challenging proposition, but we have examples of where such efforts work. We have an example of a global influenza system called JSSA, the Global Surveillance System, that is a platform that allows researchers and governments from around the world to share influenza data into a common portal. With the onset of the COVID-19 pandemic, this platform, JSSA, positioned itself to be the central repository for all of the data coming in for the COVID data as well. And so we see that JSSA have established some very stringent and very transparent requirements to ensure ownership and to avoid exploitation. So I think we have some examples out there that we can learn from. We can build on those, and it's a matter of expanding the vision of JSSA, for instance, to be inclusive of a much broader set of future viral threats, not just influenzas or COVIDs. We have potential threats from many other viral families as well. So we need to expand this vision to be inclusive of a full range of future viral families and viral threats, that ultimately the ownership is at the country level, the partnership is at the global level. I'll end my answer there.
Thank you. Thank you so much for your very comprehensive insight and answer. I think you move to the next question. I think this one is for Dr. Sawapak. So I think in your talk, you mentioned about the network is a part of success for global health security agenda. And you mentioned about the need to bring cooperative actions. In your experience, what aspect is the major problem in Thailand? Even though we have done quite well, how can we improve and make sure we have the sustainable system?
Yeah, thank you very much for this question. The challenge, this is that in the how we can involved within the other sector. It's just not in the health sector to join, because when we think about the disease, when we think about like the health problem, in the past, many sector like the general people, they thought that okay, it should be like a take responsibility by the medical doctor or in the public health office, and then how we can like a ship the idea that it's just like a health for all for health. That's meaning that the keywords that emerged during the COVID-19, this is a whole of government and whole of society. For the whole of government, that we can see that how we need a lot of cooperation from the Ministry of Foreign Affairs to talk within the other country and to share and also for in the term of the vaccine donation or in the receive some help from the other countries. And for the Ministry of Defense, this is a part that they can help us in the term of the contain the disease, and also in the Ministry of the Finance, because we know that in the COVID-19 it does not disrupt only the health issue but also economic issue. So that's why the important that how we can involve and how we can make a more concerning that is the health. It's just not only the health sector, but COVID-19 when they is more become like an endemic disease, but how we can continue the momentum that okay, it's just not okay when we COVID-19 become the endemic and then we go back to in the same loop. That's meaning that this is the challenge that we have to maintain this momentum. And for in the whole of society, just only in the public governmental sector, we cannot contain the disease. So the private sector is also one of the challenge that they need to in the term of the collaboration. And we can see from in the vaccine development that this is cover the huge contribution from in the private partner, but how they can share knowledge or in the transfer the technology to in the governmental sector. It's just not for in the one country, but for the other country that they need maybe in the knowledge or in the investment in the term of in the build up the capacity. So this is it's just not only in the Ministry of Public Health to maintain that, but it should be like a national agenda and the global agenda that come. That's why in the WHO and the other UN organization try to develop the global cooperation within the multi-sectorality.
Thank you so much. Yeah, I think it's very important for us to work together as a society, both from the policymaker level and the private sector and the operating level, and also the people in the country and as a global citizen. I think next question is for Dr. Jirut. Do you think Thai health system now is ready to cope with the next pandemic? And what do you think about the role of microbiology lab in the big hospital? Should the lab have the capability to detect new organisms using novel technique in the routine lab as well?
Okay, thank you very much for the questions. The first question, are we ready for the next crisis? Very difficult to answer, but I would say we have prepared more for the next crisis. It will not be perfect response, but it will be certainly better response, because we learned how to work together dealing with this crisis. I think how we govern the systems during the crisis changed a lot during the past 2 years. Many sectors can collaborate. Our financing system has experienced how to rapidly adjust their payment mechanisms to support providers. Healthcare providers have better information system and information sharing in terms of how to deal with case detection, case referrals, something like that. In terms of diagnosis, laboratory tests and assessment, in the past, I would say before this 2 years crisis, in the healthcare system in Thailand, we talk very little about how to send specimens between hospitals. We usually send the patient to get a test. We refer patient. We hardly transfer specimens, for example. We had not discussed a lot about laboratory hub. We discussed very little about how to come up with research and development in terms of testing kits, and try to prove that it works and can be used easily in, for example, remote areas in this country. So that's why I said we are more ready. And I totally agree with the person who asked this question that we need to have a hub for laboratory investigation and assessment that are ready for detecting new threats in health. Not just infectious diseases, but also other non-infectious, right? Like a toxic substance. We have to come up with a system that can transfer information and specimens in more efficient ways in order to detect this quickly. When we're facing the situation like this, we have to balance between efficiency, using resources, efficiency in terms of sharing, economy of scales, think about cost effectiveness, and risk management. Of course, when you want to deal with risk, it would increase the cost of preparation a little bit, but over the long run, I would say it's efficient to do that way.
Thank you so much, Dr. Jerut. For myself, I can see that things has changed a lot since we first start this hardship, and I think things will continue to evolve. As you can tell that there are so many knowledge and information that that are developed and evolve over time, and all this knowledge and information will be very useful for us as a community and as a operating level and as a policymaker to adjust ourselves for the potential threat which may arise again in the future. The next question, I think, is for all speakers. It has a different layer of opinion. So the question is how the global health security agenda can help to prevent or slow down the next pandemic. The question has three different layers. So the question at the global level and the country level and at the medical school level. So the first one, I'll ask Professor Carroll about how the global health security agenda can help to prevent or slow down the next pandemic at the global level.
Well, thank you. I think it's really an important question. And I think, in fact, it goes to the heart of the challenge that we faced with COVID-19. The virus itself has been an enormously challenging threat. But the true reality is that the biggest challenge we've had is the failure of the global community to act in a global coordinated way. And as such, we have found the ability of the virus to move around the world with the global community fragmented in terms of its response. We saw that most recently with the Omicron variant, that the initial messaging coming out of Southern Africa about Omicron immediately led to countries, including my own, penalizing Southern Africa by imposing travel restrictions that really sent a very negative signal to future identification of other variants, that if you identify a variant and share that information, there's a penalty you're going to pay in terms of international travel. The global health security agenda really needs to reinvigorate and reinvest in global partnership and a global vision. Threats like COVID-19, they're not threats to individual countries, they're threats to every country. And what we need is a strong, coordinated global response to an event such as COVID-19. So I would hope that as we essentially do a postmortem, if you will, on COVID-19, that one of the clear take-home messages is, if we're going to be successful in facing a similar event in the future, one part of it is science, one part of it is technological, but one part of it is political. And what we need is the political leadership to coalesce and really bring forward the full expertise that exists among all of us in a shared response. And I would go back to, quite frankly, when we look at the response around the world, it's been enormously uneven. My own country, we just recorded our 800,000th death. 800,000 people have died in the United States over the course of the last 24 months from this virus. And we've seen similar numbers from Europe as well. But when we look at countries like Thailand, the burden of COVID, even as it may seem enormously challenging within Thailand, it is far less profoundly impactful. And quite frankly, I would put that at the feet of the leadership that occurred within the Thai government and the way the Thai people coalesced around that leadership to really be able to mobilize a coherent response. And I would hope, as part of that postmortem, countries like the United States and our colleagues in the United Kingdom and Germany and elsewhere will really look to the countries like Thailand to learn what they did so well, so that as we think about facing future threats, we can build into our global response the positive lessons that have come from Thailand, and we can better embrace those as we go forward in my own country and elsewhere. So even though this has been impactful, we've seen certain parts of the world have responded well, other parts of the world have not. Why have Thailand and Vietnam and other countries responded so well? And why have countries like the United States and France and the United Kingdom responded so badly? And part of it has to go back to global leadership and global coordination. And the global health security agenda has to be at the epicenter of being able to bring a much more coherent, shared vision about how the global community responds to future threats such as COVID-19. As we need to understand a threat anywhere is a threat everywhere. And as such, we need to have a global coordinated response. So I would hope JSSA can really elevate the importance of global coordination, global action for what is a global threat. We've not done a good job to date, but we have much to learn from countries such as Thailand on how we could do better in the future. I'll stop there.
Thank you so much. I think it's very important for us to learn among each other to improve how can we interact with the future threat. In the next level, it would be at the country level. Please, Dr. Savapat.
Okay, thank you for the question that Dr. Carroll already addressed in the global level. For the country level, even that we look at in the framework of in the JSSA, we have in the different action package, just like a surveillance, AMR, immunization, workforce, and also laboratory. Okay, this is kind of in the action package. That means that they involve within the multi-sectorality. So the multi-sectorality collaboration, this is a keyword for in the JSSA framework. And also we can see the task force. They have like the task force up in the accountability, task force up in the sustainable finance, preparedness. So it means that in the multi-sectorality and coordination, this is kind of like the key key source or in the keywords of in the how we can contribute to JSSA at in the national level. So we have to adopt this kind of like a multi-sectorality and the coordination at in the national level. When we say that in the prevent, detect, and respond, for example, for in the detection, even in the past, the detection, maybe in the, we just say that, okay, there we discover the pathogen at the laboratory, and okay, that is good. But then now we share the idea that even the we can like move the surveillance idea, the concept, it's just not to in the laboratory, but we go to down into the community level. So we can see that in the village health volunteer. This is just in the smallest unit that in the part of in the hour in the term of in the public health system, but they can help us to identify, to like to see what in the long that occur in their communities. That means they can help us to be a part of reporter to in the upper level, and then the next activity is just like an investigation or in the control disease. It can be like the further activity. So it means that in the national level, we have to like implant the idea of in the surveillance, of in the early detection to the people beyond the health sector, to the beyond in the just in the governmental level, but how we can go it into the community level. That means they need the sense of in the how to report and how to make the early detection in the term of the surveillance occur at in the smallest unit. So this is will be kind of like a handheld as to even though we can detect quicker, it means that in the smaller like an impact for in the it's just not the health system, but in the whole system.
Thank you. And I think from what I experienced from my foreign colleague, that's the unique part of the healthcare system in Thailand, that we have the health volunteer who help us a lot in this pandemic. And for the medical school level, please, Dr. Jarut.
I think medical schools are key players, one of the key players in the health systems, both in normal time and during the crisis. So we should take active roles in help preparing the health system for the next crisis. The basic missions of medical schools are, of course, research and innovation, teaching, and service. So I would like to address all these three missions. Research and innovation should include both all the way through the value chain of the research, from basic science, clinical science, and also health policy and systems. We should continue to engage into basic science research in order to come up with the way to help, for example, disease surveillance with new technologies, more effective tools and techniques that people can use in order to detect new threats, and also how to manage information with new and advanced technologies like genomics to help identify these new threats, for example. We have to continue to do a research in clinical fields in order to come up with a new way for diagnose patients and treat patients effectively, and be ready to transfer this knowledge to other healthcare providers if the crisis comes. So we should not do this alone, but we should do it in a network so that we can do an information and knowledge sharing so that we can build new knowledge more quickly. We, as a medical school, should also be engaged in policy and system research. We may not be able to do it alone. We may have to join task force with other areas of expertise like economics, social science, political science, maybe humanities, so that we come up with better policy at large, so that we can drive the system forward to be more resilient to this kind of threats. Okay. Besides research and innovation, we teach. It's our role to ensure that new medical graduates and specialists will not forget about this crisis and have to learn from this crisis, because we don't know when the new crisis will attack. The new generations of medical professionals may not have learned about this if, for example, right now they are high school students. So they have to make sure that what we learn today, whether it's in basic science, basic medical science, or clinical science, or how the system responds to the COVID situation, integrated into medical curriculum, so that they will know what they have to do during the crisis time like this. Okay, and we have to ensure continuing education, lifelong education, so that medical professions as well as other allied health professionals can continue to learn how they can effectively respond to emerging diseases like this. Okay, and of course, services. We provide healthcare services, maybe through the in-house hospitals or affiliated hospitals. So knowledge transfer to help these providers build their capacity and be more ready to deal with this kind of crisis is a key. We also need to be more research in nature, come up with a new prototype of facilities, healthcare organization that are ready to cope with these unexpected events. Maybe we have to be not just referral centers, but because of the mission to be ready for teaching and research, we may have to become a front line, maybe the first institution to deal with new discovery of new cases like this. So that's the part in services. And with this commitment, like the teaching and research, we have to share this information so that we can help empower, strengthening other providers in our country, in our region, and globally. Thank you.
Thank you so much, Dr. Tirut. I agree that it has become very evident since the pandemic started that the medical school has been one of the key players that play a role in this pandemic, both in the service level, the teaching level, and the research level. So I think we come into the conclusion of today's academic forum. I would like to thank you all the speakers for your excellent presentation today. I'm certain that all the audiences, including me, learned a lot from today's School of Global Health Forum. As you mentioned, we have come this far throughout this pandemic hardship, but we still have a long way to go. Global health security is a critical topic that raises our awareness to better prepare ourselves as a global citizen for potential threats in the future. The School of Global Health, Chulalongkorn University will host the academic forum highlighting important health issues every 2 months. Our next forum will be held again tentatively in April. Please visit our website for more information. We will post and distribute more information within the next couple of weeks. Lastly, I would like to invite Professor Sutipong Vacharasin, the president of the School of Global Health, Chulalongkorn University, to give a closing remark and appreciation speech to our speakers and attendants. Please welcome Professor Sutipong.
Thank you. Eventually, we come to the end of the section. On behalf of the School of the Global Health, Chulalongkorn University Faculty of Medicine in conjunction with the Thai Red Cross Society and Chulalongkorn Medical School Foundation. I would like to thank all the prominent speakers, Professor Carroll, Professor Sawapak, and Professor Jilut, for your sharing the experiences and vision to inspire us to be concerned about the global health. And we aim for the good health for the global populations. So I also would like to thank all the participants that you stay with us until the end of this section. And we do hope that you enjoy our meeting, and we look forward to welcoming you again for the next School of Global Health Forum. Thank you and goodbye. ขอบคุณครับ
Again, on behalf of the School of Global Health, I would like to thank all the audience and speaker for joining us today. See you again in April.